It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
And hi again, everyone. Jim Knox along with Candace Kruger, and welcome to another edition of the Best Docs Network, featuring some of the best doctors and procedures in the Dallas-Fort Worth area, helping change people's lives.
That's right, like our first doctor, weight loss surgeon, Dr. Philip Swanson.
Going through the education related to nutrition is critically important, and we always encourage people to make small changes in what they eat.
I was feeling like my quality of life was slowly starting to deteriorate. I was starting to have some other medical problems with high cholesterol, high blood pressure, and it was just one thing after another, and I just felt like, you know, I had too many more years to live, and I didn't want to live having to deal with those kind of problems.
We talk about exercise, and I'm not talking about going to the gym for 2 hours a day. But if you can do things like, when you go to a drive-in place, don't drive in. Park your car, walk the few steps to get in, walk back to your car. Little things like that can make a dramatic difference in somebody's life. And there are things that people need to know about so that they can change things in their general life and make things better. So again, education is critically important in this process of surgery, particularly related to weight loss. If you can get out and walk on a regular basis for 45 minutes every day, or do some other kind of physical activity on a regular basis, then you are stimulating your metabolism. People regularly talk about, oh, I have to eat every 2 hours, otherwise my body's going to shut down. That's not it. A lot of people will not eat breakfast, not eat lunch, just have one meal at night. The problem with that is they're so hungry that they eat until they are just stuffed. And they're getting way more calories than they would have gotten if they'd eaten regular meals during the day. The problem with most people who choose to have bariatric surgery is the fact that they are 100 pounds overweight. You can't lose that and keep it off year after year after year.
As part of my lifestyle change, obviously you make eating habit changes, but I also joined the gym to really change my physical activity. I had taken advantage of the second chance that I got to change my life.
Roger had a traumatic spine injury that kept him from walking until he met Dr. Rebecca Stachniak. To find out more about Roger's story and other life-changing stories, log on to bestdocsnetwork.com.
When I was 5, I was swinging on a chain that was blocking a driveway, and the chain broke. And I fell on my nose, broke my nose, injured all my nerves. And when my second teeth came in, I started getting abscesses at the age of 8.
Betsy was first introduced to me by her dentist, part of our EverSmile team, and he called me and said, listen, she is so nervous. She didn't even sit in our chair.
I was so nervous when I came to Dr. Wallace and my dentist. I could barely sit in the dentist chair. And I knew something had to be done, and I was just hoping that the technology was there so that when I was ready to do this, that everything would be in my favor.
We did our CT scan here in the imaging center. We got everything medically wise ready to go for surgery. She came in on Friday. We put her to sleep, did her surgery, woke her up and sent her home, and she was very comfortable. She was very happy. She had a beautiful set of teeth.
I'm very happy with the results. They listened to me, they gave me what I wanted, and that was really important.
That was her biggest worry, is that she always was worried that her teeth would fall out. She couldn't drink anything with ice or anything that was cold because it would always hurt.
Just a drink that would be colder than room temperature was always an issue. I always had to use a straw. Even if it was hot, I had to be really careful not to have the liquid go up over my cap and hit my tooth.
She's just an amazing lady. She's overcome a lot with her own fears to get to the point where she is now. And now she has a beautiful set of teeth and she's happy. They look beautiful, they chew, she can do whatever she wants with them. She doesn't have any pain using them.
I'm told that I can eat anything, but I still haven't taken a bite out of an apple. Dr. Wallace heard that and he said, "You're going to eat an apple today."
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
Many of us live with pain, but you don't have to. PAMA's here to help. Whether it's sports injuries, arthritis, or joint pain, the physicians of PAMA are dedicated to your wellness and getting you back to pain-free days. So what are you waiting for? Go to PAMAinc.net and find a physician or orthopedic specialist who can help you stop pain and live life to its fullest again. PAMA, pain freedom. Go to PAMAinc.net.
The Best Docs Network is brought to you by Modern Luxury Magazine, the premier magazine in the Dallas-Fort Worth area.
About 10 years ago, I was having a lot of shoulder pain, and I had seen several doctors prior to that, and they told me that I had a problem at C6, C7, and I was looking at surgery and a possible spinal fusion. So I called my friend who works in critical care, and I said, "Who's the best neurosurgeon out there?" And she gave me Jeffrey Cattorini's name. So I went to him. He said, "Your symptoms don't fit your MRI. Your MRI is wrong." And I had seen 4 previous physicians prior to that, and Dr. Cattorini is the one that caught it. I get emotional.
One of the procedures we offer here in the practice is insertion of a cervical artificial disc. We see patients age 20 to 55 who have a soft tissue disc herniation or one-level disc disease. They typically present with one-sided neck pain and arm pain.
He came and sat right down next to me, and he showed me the artificial disc and the way it worked and the way he would screw it in. And I said, "You know what? That's a metal disc, ball and joint. That makes sense to me." You know, I didn't like the idea of pulling bone out of my joint or out of my hip and then fusing my neck, and I have limited range of motion. That just didn't make sense.
The good thing about the artificial disc is not restricting movement, it's keeping movement. And there's no need for a cervical collar post-op, or there's no need for a bone growth stimulator post-op, because you do not want to promote a fusion.
And I woke up from surgery, the pain that I had had for over a year was gone, and I just bawled. So right after the surgery, I was out there playing tennis immediately with absolutely no pain. Best decision of my life.
Nancy did great post-op. She returned to her activities. She's actually referred friends from out of state for the artificial disc, and she's very happy with the results, and she's got great range of motion.
Go to a neurosurgeon. They're meticulous, and especially go to Dr. Jeffrey Cattorini, because he's outstanding.
There's 2 main types of arthritis. There's osteoarthritis and there's rheumatoid arthritis. Osteoarthritis is common, rheumatoid arthritis is not. Osteoarthritis is mild to moderate. Rheumatoid arthritis can be a very bad disease. And how do you tell the difference? Well, osteoarthritis is usually wear and tear of weight-bearing joints like the knees, or joints in your hands, the ones that move a lot, like this one right at the base of your thumb. Rheumatoid arthritis involves usually the knuckle joints. It can involve a lot of other different joints, but those are the main ones where they start. And it starts with stiffness in the morning. Now, osteoarthritis results in 15 to 20 minutes of stiffness in the morning. Usually goes away once you get up and move around and sort of oil your joints up a little bit. Rheumatoid arthritis results in sometimes 2 to 3 hours of stiffness. So if you have a lot of stiffness that lasts a long time in the morning, that generally could be rheumatoid arthritis. Again, it's a rarer illness than osteoarthritis, but it's also much worse, and there's a lot that can be done to make it improve and not progress and cause crippling deformities.
When you get over 50, you start to feel the age catch up on you. I work out and I stay in shape, but even with my gym experience and working out most of my life, I still feeling kind of run down.
He performed a hysterectomy, and we started the hormone replacement therapy because I was having the hot flashes, and I just wanted to feel good. I was feeling tired, run down mostly.
When you're younger, you have a good amount of hormones. What we try to do is we try to assess the hormones of a patient at the age they are, and then try to supplement her hormones with hormones to give her the level of hormones that she had when she was younger. We achieve those hormone levels with the use of pellets. These small pellets go inside in the fatty area. You don't even see them. The incision is extremely small.
Numb the area, and they just put a little slit, and they put in the number of hormones that you need. They do a blood test first and find out what you lack and what you need, and they put those in there, and they put a little Band-Aid on there, and you don't take it off for like 3 days. And it gave me more energy, and I noticed that my nails, are growing now, and I feel like a teenager again too. We work out and ride motorcycles together, and we just, I just feel great.
Libido kind of lags along, and you get the hormone the hormones right, and everything starts to work again. It works, very well.
Generally speaking, within 24 to 48 hours, patients start feeling a little better. If they had hot flashes, that tends to go away. Energy level starts to increase on a gradual basis over the next 1 to 2 weeks, and a libido does the same thing. Libido, sexual drive, tends to increase over the next 2 to 4 weeks, such that at the mid, they have the peak of the energy level and libido, and they're just feeling real good.
The thing I like about Dr. True is he practices what he preaches. He also is on the pellet therapy.
He is very personable. He makes you feel very comfortable. He treats you like you're the only patient he has.
Bonnie has a beautiful baby girl, and she credits obstetrician Patrick Allen for possibly saving her life. To find out more on Bonnie's story and other life-changing stories, log on to bestdocsnetwork.com.
Well, we were married in 2005 and tried for 3 whole years to try and get pregnant, and which wasn't working. We came to Texas and spent a year trying here under a doctor's care, and eventually underwent a series of testing and determined that our chances of getting pregnant on our own were less than 8% over our entire lifetime.
Jessica and Philip came to us a few years ago with the need to pursue IVF, in vitro fertilization. They knew about our program, they knew about our success rates, but one of the unique issues with Jessica and her husband were they did not want twins. They were a young couple, they knew the amount of work it takes to raise a family, and one of the goals for them was to achieve a singleton healthy pregnancy.
He kind of walked us through, what the steps would be, what each thing we would do, how we would go through it, and I think a lot of it was just a comfort, it's a very emotional thing.
We took them through the process of IVF with the placement of a single embryo, and they had a very healthy boy.
So you go through all of the procedure of all of the drugs and everything and the medications to try and prime your body for pregnancy, and you do a retrieval where they take the egg out of your body and they fertilize it, and then they inject it back into your body. That's transfer day. And there's 5 days in between, typically, where the egg lives in a petri dish and they watch it grow, and then they put it back into your body. And at that point, you either conceive or you don't conceive, but you can't know for 2 weeks.
Another year went by and they came back again, and we did the same thing. They conceived again on the second cycle, and they have a healthy girl.
I went to a Gymboree class. They were talking about how you take pictures of your kids, and I said, well, I have a picture of my son at 5 days gestation. It's just a little blip in a petri dish. Those are the pictures I cherish, are those that, we know that we have life at 5 days. There were 2 people in the class that day that were like, oh, I have the same picture, we did the same thing. It was just, really comforting.
At Dallas IVF, we're able to provide the full range of infertility treatments without the need for patients to travel outside the area. The goal of our practice is to have healthy pregnancies.
I'm happy with our results and our process and our decisions.
For more information on any of the doctors you've seen on today's show, just go to our website, bestdocsnetwork.com.
Right now, Candace, you know the next place to go? It's our next doctor. It's Dr. Patrick Allen.
That's right.
My 2 young children and my husband and I were in Disney World, and we had a great time for a few days in Disney. The last day of our trip, we went into the hotel room, laid down, exhausted, and I ran my hand across the top of my tank top and felt a lump in my left breast. Returning to DFW, I went in to see Dr. Allen, who then sent me for a mammogram.
And I think it's important that for patients, if they feel a breast mass, that they get in, have it evaluated. Sometimes that's imaging studies, sometimes that's ultrasound, sometimes that might be a MRI. Some of these are benign things that maybe it's a cyst that needs to be drained, so maybe it's a little fibroadenoma that just needs to be watched, but sometimes they'll be breast cancers.
When I saw Dr. Allen, he sent me for a mammogram and an ultrasound just to get a better look at the lump. After the mammogram and the ultrasound, I got the results in the mail saying that it wasn't anything to worry about. They felt like it was a fibroid adenoma, and to come back for another mammogram in a year. And at that point, Dr. Allen, I feel like, changed my life because he didn't accept that. And he went ahead and sent me to a breast surgeon just to make sure.
And I want the breast surgeon to make a decision on the patient. I want them to decide. They're the ones that usually have the experience to say, I can watch this, I need to biopsy this. And a lot of times they go over these risks and benefits with the patient as well, and they'll be able to give them some guidance on which way to go.
After going to the breast surgeon, she said she felt like it was a fibroadenoma, but because of the size of the tumor, she wanted to go ahead and take it out. When she took it out, that's when we found out that it was a very aggressive form of breast cancer. I was only 34 when I initially found it. I was staged at a 2A, so it was relatively early. But because Dr. Allen pushed and didn't just stop with the results of the mammogram, I feel like he saved my life.
Many of us live with pain, but you don't have to. PAMA's here to help. Whether it's sports injuries, arthritis, or joint pain, the physicians of PAMA are dedicated to your wellness and getting you back to pain-free days. So what are you waiting for? Go to PAMAinc.net and find a physician or orthopedic specialist who can help you stop pain and live life to its fullest again. PAMA, pain freedom. Go to PAMAinc.net.
David lost over 100 pounds, and he credits Dr. Carol Norton in helping him lose the weight in a non-surgical way. To find out more about David's story and other life-changing stories, log on to bestdocsnetwork.com.
Prosthodontics is the name of the specialty, and it's one of 9 dental specialties recognized by the American Dental Association. It's a specialty that requires 3 years of additional training at a dental school level. It's 3 years dedicated to the specialty of prosthodontics, which is reconstructive dentistry, including dental implants, crowns and bridges, dentures and partials, some TMJ treatment, and other small areas of dental reconstruction that most people will never need. A typical patient that finds our practice has needs ranging from fillings all the way up to full mouth reconstruction. We handle everything in-house. By having everything in-house, we have total control of patient outcomes, and that's our main goal here, is to have fantastic outcomes. One of the biggest strengths of my practice is the amount of time we spend with each patient. It's all about education here. Every new patient is scheduled for 1 hour, and we go through their complete diagnosis, their treatment plan, and we attempt to educate them on all the options that are available. And it's one of the things that I enjoy the most about my practice is getting to know the patient and helping them understand their problems, but also giving them several different options on how to fix their problems. We often have multiple try-ins so that we don't just make the patient look good, but we make them look fantastic because we've taken the time to pick the right tooth size, tooth shape, and tooth color that fits their complexion and their facial shape. Another way that my practice significantly departs from common implant treatment is that I do everything myself. I do the planning, I do the surgery, I do the teeth. It's all me and my hands fabricating these restorations for the patient. There's not a laboratory technician that comes in during the procedure, and no one else touches the patient's care except me. We're committed to patients having long-term success, so we do provide all phases of services, including cleanings and maintenance. Often I frustrate my patients because I'm so picky about their outcome that we sometimes have to make changes or we have to redo the restoration if I'm not satisfied with it. But it's important to me that we get it just right for every patient, whether it takes extra time or not.
The Best Dogs Network is brought to you by Modern Luxury Magazine, the premier magazine in the Dallas-Fort Worth area.
I've been a member of a band called Master Bones Jangle, and the Voodoo Island Cannibals were actually a pirate band. There were several times in which I've had to miss entirely the ability to go out and play with the band that I'm in and enjoy those things. Not to mention the fact that several times, band aside, I've got a 3-year-old, and more often than not, I couldn't play with him, I couldn't pick him up, I couldn't interact with him. He would crawl up into bed with me and, you know, he'd say, Daddy's sick, and he'd get his doctor kit out and try to make me feel better, but there's nothing you can do.
In this particular patient, she had multiple recurrent episodes of diverticulitis. Diverticulitis is an area where there are inflamed or infected pouches or outpouchings of the wall of the colon.
When I first came to see Dr. Macaluso, I was experiencing a lot of abdominal pain. This went on for quite some time until finally my primary care physician referred me to Dr. Macaluso.
The most common area to get diverticulitis is what's called the sigmoid colon, which is on the lower left side of the abdominal cavity and in the pelvic region above the suprapubic bone.
Unless you are having those kinds of pains, unless you are really understanding what kind of agony that is, you don't realize how good it is to simply not be in pain.
A lot of times this can be treated with medications such as antibiotics. However, if you continue to have multiple recurrent episodes of 3, 4, or 5 episodes of diverticulitis, or the attacks of diverticulitis become more frequent in time, these are the patients that we typically recommend they undergo a laparoscopic colectomy.
My recovery time was minimal at best. I was out of the hospital before the weekend was over and my surgery was on a Thursday.
The small incisions allow for quicker return to work, quicker return to normal activity.
I can actually bend down and play with my son and not worry about having to lay on my back to try to find relief from the pain. From the time in which I met him to the pre-surgery procedures, the post-surgery procedures, and then the follow-up thereafter, he's almost been like a friend. I would absolutely recommend him to anyone going through this.
Vincent's severe back pain kept him from playing the game he loved, soccer. That is until he met Dr. Robert Miles. To find out more about Vincent's story and other life-changing stories, log on to bestdocsnetwork.com.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
When you hear stages of cancer, basically stage is just a way of classifying how far the cancer has spread. And every disease type has their own way of staging things. So the staging for breast cancer is not going to be the same as staging for ovarian cancer, obviously, because it's completely different diseases. But that's generally what we're trying to do, is trying to get an idea of how advanced the cancer is. And once we know how advanced the cancer is, we can generally give people an idea of what the prognosis is. And that's ultimately what's important. You're not so much worried about stage, you're more worried about, are you going to be able to cure this? So, and stage kind of gives us an idea of what the cure rate would be. For gynecologic cancer, after surgery and what we call adjuvant therapy, and adjuvant therapy will just be either chemotherapy or radiation after surgery, patients undergo what we call surveillance. Surveillance is just a fancy term for keeping a close eye on things. Typically, we have the patients come back into the office anywhere from every 3 to every 6 months for an exam and blood work. We want to keep an eye on things to make sure that the disease doesn't come back. Chemotherapy is just a fancy term for medical therapy. Traditional chemotherapy is an IV infusion. So just like if you were to go to a hospital, you get an IV placed, and these are medications designed to help kill cancer cells. And for the most part, the way I describe it is it's very expensive, very well thought out poison. And it's poison that's designed to help kill cancer cells before it causes too much damage to normal cells. Length of treatment depends on the type of cancer the person has and the treatment option that they decided for. But usually it's about a 18-week treatment course. There's a number of trials that are ongoing through our research division that's based out of Mary Crowley here in Dallas. We have a number of clinical trials open for not just gynecologic tumors, but also breast cancers and multiple other disease sites. We have targeted therapies. We also have tumor-specific options, such as vaccines. So a lot of these tumor vaccines are created at the time of surgery, where samples of a person's tumor is sent to a lab, and this lab creates a vaccine targeted specifically against that person's tumor. That's something that's under clinical trials here in Dallas that I'm very actively participating in.
Asthma is an inflammatory disease of the lung. It affects the bronchi mainly. They develop inflammation that causes the bronchi to develop muscular spasms, and that gives the person a sensation of tightness.
I was able to play with my friends, but when I was running on the playground, it felt the same as it did in gymnastics.
Many times asthmatics cough a lot more than they wheeze, and because they don't wheeze, people don't think that they have asthma, and they don't get checked out for asthma.
I try not to pay attention to it because I didn't want it to interfere with my gymnastics and what I was doing.
She was saying she was tired all the time, she was falling asleep, she didn't want to go play, and I mean, she didn't want to do really anything.
In someone like Abigail, who's a child, they don't even realize that that's not normal. She thought she felt like everybody else did. And they don't report it to their parents or their doctor or anyone. We were just very lucky that we found that out.
When she's talking to the kids, she said, I want other kids to know that there is something like this, and that maybe if they have it, they can have a different life too.
That will do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best doctors as well as procedures in the Dallas-Fort Worth area that help change people's lives. And for more information on any of the great doctors you've seen on today's show, head to the website, bestdocsnetwork.com.
That's right, and if you have a question or comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com. So long, we'll see you next week.